What is tuberculosis? Tuberculosis is a highly contagious disease caused by the mycobacteria. It is transmitted through the air when an infected person coughs or sneezes, releasing tiny droplets containing the bacteria. When inhaled by others, these droplets can lead to a TB infection. When a person inhales these droplets, the bacteria can enter their respiratory system. Once inside the respiratory system, Mycobacterium tuberculosis encounters immune cells called alveolar macrophages in the lungs. Instead of being immediately destroyed, some bacteria can survive and replicate within these cells. The immune system recognizes the presence of Mycobacterium tuberculosis and attempts to contain the infection. Immune cells, including T cells, are recruited to the site of infection, leading to the formation of structures called granulomas. These granulomas are collections of immune cells and infected macrophages that wall off the bacteria. The immune system tries to control the infection by releasing various immune factors, such as cytokines. This process triggers an inflammatory response aimed at killing the bacteria. In some cases, the immune response is successful, and the bacteria become dormant within the granulomas. This is known as latent TB infection, where the person carries the bacteria without exhibiting symptoms. In some individuals, latent TB can become active if their immune system weakens due to factors like HIV infection, malnutrition, or certain medications. When this happens, the bacteria can break out of the granulomas and cause active TB disease. Mycobacterium tuberculosis has developed several strategies to evade the host immune system, allowing it to persist within the granulomas for years or even decades. These strategies include a protective cell wall and the ability to resist the killing mechanisms of immune cells. However, if the immune system is unable to control the infection, active TB disease can develop, with symptoms like coughing, fever, and weight loss. There are several ways in which TB is diagnosed. 1. Medical evaluation. If TB is suspected due to symptoms or exposure, a healthcare provider will perform a thorough medical evaluation, including a physical exam and medical history. 2. Tuberculin skin test or TST. This involves injecting a small amount of tuberculin under the skin and checking for a reaction. After 48 to 72 hours, a positive TST indicates exposure to TB, but does not confirm active disease. 3. Interferon gamma release assays. These blood tests, like the quantiferin TB Gold test, check for the presence of TB infection. 4. Chest X-ray. An X-ray can reveal abnormalities in the lungs, such as the characteristic TB lung lesions. And finally, 5. Sputum culture. A sample of sputum mucus coughed up from the lungs is collected and cultured to confirm the presence of the TB bacteria. TB is treated with a combination of antibiotics. The most common medications include isoniazid, rifampin, ethambutol, and tirazinamide. Treatment typically lasts for several months to ensure all bacteria are eliminated. 2. Directly observed therapy. To ensure patients take their medication consistently and correctly, healthcare workers may directly observe medication administration. Adherence. It's crucial to complete the entire course of treatment, even if symptoms improve before the medication is finished. Stopping treatment prematurely can lead to drug-resistant TB. TB vaccine. The Bacillus calmette-guerin (BCG) vaccine can help protect against severe forms of TB in children. However, it is not widely used in countries with low TB rates due to its limited effectiveness in preventing adult pulmonary TB. TB infection control. Preventing the transmission of TB in healthcare settings is critical. This involves proper ventilation, use of masks, and isolation of patients with active TB, screening and testing. Individuals at high risk for TB, such as healthcare workers and those in close contact with TB patients, should undergo regular TB screening and testing. Treatment of latent TB. Individuals with latent TB infection, TB bacteria in the body, but not causing illness, can receive preventive therapy to reduce the risk of developing active TB. Education. Raising awareness about TB, its symptoms, and the importance of seeking prompt medical care is essential for prevention and early detection. Contact tracing, identifying and testing individuals who have had close contact with TB patients can help prevent further transmission. Tuberculosis exerts a profound global impact. It ranks as a top infectious disease killer, especially in low and middle-income countries, straining healthcare systems and economies. TB's international spread threatens global health security. Amplified by drug-resistant strains, combating TB necessitates international collaboration, research, and funding to develop better treatments and prevention strategies. A comprehensive approach is essential to mitigate its devastating effects on individuals, communities, and nations. Tuberculosis is a global crisis with multifaceted consequences. It ranks as a top infectious disease killer, particularly impacting low and middle-income countries, straining healthcare systems, and fueling economic challenges by hitting people in their prime working years. TB's capacity to spread internationally threatens public health security, compounded by drug-resistant strains. A holistic approach is vital to alleviate TB's extensive repercussions on individuals, communities, and nations around the world.